Hi, this is Sam Collins, your coding and billing expert for acupuncture, specifically the American Acupuncture Council Information Network, as well as seminars, and of course, your malpractice carrier. Today's program is going to focus again on being in or out of network, but it's more of an update to kind of keep you up to speed as to what's occurring. There's recently been some changes for American Specialty Health related to California and now New Jersey, and then also some updates for the VA as to who's handling the VA. So let's get started. Let's go to the slides and let's talk about just being in or out of network. And I've got to make sure I can switch. There we go. So for managed care, of course, that's what we mean being in network. It's a trade-off. And so you see here that, of course, it's the plans offering. You get more patients, but you get reduced reimbursement. And the one thing I'll always focus on or have you focus on is when you join, whether or not there's a value to being a member of the plan. And we'll talk specifically about these ASH plans in just a moment. But always remember to keep it simple. If the plan is exclusive, there's a high likelihood you may want to join because otherwise the patient has no benefits with you whatsoever. Now, of course, they can still pay cash, but very unlikely to seek care because they're going to go where they can use their insurance. However, what if the pay is not reasonable? And this is the hard part I think most acupuncturists have, particularly with plans like ASH. It is hard to manage a patient where you have to deal with insurance for a rate that is below what you actually would even charge a cash patient. Let's remember, often you're charging a cash or a prompt pay patient less than what you would charge an insurance patient, not by much, but less because there's lesser paperwork, lesser administration. And so therefore, it's hard to manage when you've got these managed care that requires so much more information and they require the extra work for lesser pay. So you do have to look, if it's exclusive but the pay is not reasonable, very likely not to join. With an American Specialty Health plan, you're talking to a $40 to $50 reimbursement, kind of hard to make an office function, particularly if you're in a high rent area. However, what if the plan is non-exclusive, meaning they can go in or out of network? Well, in my opinion, why would you join something where the patient has a choice to go out of network just as well? By example, there are plans with United Healthcare and Optum Health that actually pay more money to out-of-network providers than in-network. Often people are joining different groups through to join Cigna, and Cigna has a much better benefit out of network. So it's certainly something to look at to decide whether or not to join and really look at, is the pay reasonable, but also is it exclusive? And or if the pay is low, do they send you a lot more patients? That volume can make up the difference. But what you have to think of is take a look towards the bottom here. You'll say office costs to treat a patient. If your overhead is, say, $4,000 a month, as you can see in this example, and you see about 100 patient visits a week or 25 per week, or excuse me, 100 patient visits per month and 25 per week, that means your visit threshold is $40. So in other words, if you make 40 only, you can only pay for your office, not for yourself, not for your home. So certainly you have to have a much higher reimbursement. So in this case, if you're getting a $40 reimbursement from ASH, you're actually having zero profit unless it brings in a new patient. So really that's the issues we have to deal with. So here's something, of course, that we used last time that we talked about the company American Specialty Health and their management of Blue Shield of California. There's been a lot of people wondering, well, what's gone on? Well, you'll notice right here in the second line, it indicates towards the end in a significant number. What this means is American Specialty Health is certainly contracting with some Blue Shield plans, but not all. I can state not all because if it were a majority of plans, I'm pretty sure they would indicate majority, but they chose the word significant. In addition, you'll notice the date here is September 6th. It says that's the date you have to sign up. Now, what I found interesting, this doesn't begin until January, then why such the push for this date here? Well, partly it's because if they didn't get enough numbers, that's going to be an issue. But let's talk about if you join, what does this mean? Well, if you join, the exams are between 30 and 40, or for a new patient, 20 and 30 for established. For the first set of acupuncture, $41, second set, $7, which I will say makes no sense, but whatever. Then the therapies are all $10 no matter the type. They do allow home visits, but I think the big issue, and I put it in red here, it's a $48 per max visit, and it's inclusive. So I don't care what services you provide, the most you're going to get is $48 per day. So chances are you're going to max out each time unless you just do one set or don't do any other treatment along with that patient. So to me, that's a pretty difficult management prospect for that type of money. That being said, that's better than what they're paying on some plans now, but not much better because it's only 42. There also will be a 5-visit threshold for in and out of network. Fees are same for in and out of network. Now, this is where I want to speak to everyone. If a plan will pay you the same amount of money out of network as in network, why would I join and be beholden that they have control over what I do, how many visits? This way you have a little bit more control over what you're doing. So what's really occurred here is by September 6th, and I'm awaiting to hear, and that's why I want to do this show today, I'm waiting to hear whether or not they got a high enough percentage of acupuncture and chiropractic providers who will participate, because otherwise ASH will not get this contract. Now I want to be careful. I'm not saying at all ASH is a bad company. They're certainly there to help with management and so forth. However, the issue becomes most people acupuncturists are getting paid the same amount of money as anyone has been paid for the last 10 years. So what I'm getting to here is if you've been paid the same amount of money anyone that did, I'm not so sure this was a viable benefit considering the patients will still have the same. Considering the patients will have the same type of benefit whether they're in or out of network. So something I want you to keep in mind is in joining these plans, you certainly want to understand that what am I going to get out of it as a provider, and will this be viable for my office? Do I really want to join? And the interesting part will be, will they actually get this contract? Now, the next factor that's gone on, and this is also what I want to update. So you notice it says Horizon Blue Cross Blue Shield will be contracting as of January 1st. Now, this is going to be a little bit different. You will definitely have to join because it's going to be covering all aspects of acupuncture, chiropractic, occupational therapy, and physical therapy. But the big issue is it's going to be the majority of plans. You notice this guideline includes all of the fully insured plans, federal employee, Medicare Advantage, self-funded, and will apply to fully insured members enrolled. In other words, it's only not going to include the plans you see here, New Jersey health plans, total care, and Medicare supplemental. The difference here is when you join, in order to stay in network with Blue Cross Blue Shield of New Jersey or Horizon, you must join ASH. Now, this is a bit different in this sense. The good news is on these plans, though you're going to join ASH, it is not going to change the pricing. All they're going to affect is the amount of visits or the medical necessity. So it is going to be a mandatory thing that you will have to do to sign up if you want to remain in network. Now, if you get out of network, will they still have benefits? Yes, but these benefits will be far less. And remember, if you are out of network with this plan, they are going to, of course, not send the check to you. The check is going to go to the patient. So something to keep in mind. I think here what's important to really focus in on is that what they're looking to do in New Jersey is really just control the number of visits. As I'm sure you're aware, many patients with these plans get anywhere from 25 to 40, maybe 50 visits per year. And often a patient feels that if they get those visits, they're allowed to use them at their leisure. And unfortunately, that's not really what it is intended for. It's intended for them to use when it's medically necessary. So certainly what ASH is coming in to do is really look at the medical necessity. So what they're going to be doing is looking at clinical performance. With this new system, everyone probably will come in with probably about 5 to 12 visits allowed. And then from there, you'll have to request more. Now, this is where ASH will make a difference. What they're looking to do is just really manage to make sure care is medically necessary. And what I want you to focus on, and this goes with anyone, regardless of the plan, they're going to look for significant durable pain intensity decrease. What this means is focus in on the patient's pain level, but not a pain level related to when it's at its worst, it's a 10. Tell me how the pain level is affecting their function. So if a patient has a pain level of an 8 this week, you want to know, what does it affect you doing? Can you not sleep through the night? Can you not tie your shoes? Can you drive your car? But any type of activity. And then when it goes down to a 6, how those improve. The other factor that they focus on is functional improvement. And what they noted is by clinically meaningful improvement on validated disease-specific outcome instruments, return to work or documented improvement in activities of daily living. And what this would be the emphasis, when you're treating someone and their pain is reduced, they are going to feel better with pain, but their function is better. Always highlight something specific about the patient's function or ability to move ability to do a task. That which means they're looking at guidelines that indicate acupuncture works pretty well. Most patients within 2 weeks of care certainly should have a pretty significant change in function and pain. If there's none, then obviously care is not going to work. And it doesn't mean that everyone gets well in 2 weeks, but there's a high expectation generally that many patients with their 6 to 8 visits for most manageable things generally will uh, focus in or will probably reduce their pain greatly within that time, meaning it's going to be harder to get much more from it unless it's a much more severe problem. So, one of the things they also look at is complicating and comorbidity factors. So, complicated and comorbidity factors, these are things that aren't necessarily treating directly, but affect recovery. Think of patients with arthritis with chronic pain, patients with underlying diabetic issues, patients who are severely overweight, patients who are just unhealthy in any other way, anything that you can highlight as to that might increase care, that's where the issue is going to be. You're going to have patients that are going to need more than 6 or 8 visits. The good news is many only need that, but those that need more, we should be able to document the why. The other factor that's gone on, and you'll see here some listing for veterans, and this is, proudly caring for veterans, and I'm sure many of you are aware of the good Veterans Choice Program, or what I should call the Community Care Network for veterans. However, there's been some updates. The Veterans Community Care now is being managed not only by the company TriWest. So for those that remember in the past, TriWest was managing the West Coast, and a company, HealthNet, was doing the East Coast for the most part. They made such a mess of it, I should say HealthNet did, that TriWest was given the full contract. But frankly, I think TriWest was having a hard time managing all of those. So now they've awarded an additional contract to the company Optum Health, who is essentially United Healthcare, to manage the new networks or a different set of networks out of state. So here's what I'm going to make sure. TriWest now handles what's called Region 4. And you'll see all the states represented here, basically from Texas all the way over, is through TriWest. So if you're in these states, you will maintain working with TriWest directly for all the community care network. However, every place else is going to be through Optum Health. So regions 1, 2, and 3, which are all the states, basically East Coast, Texas, and on the East. The difference is this isn't all occurring overnight. It appears it's being rolled out in sections. So you want to verify when your area is going to change over because it's going to be managed there. Because obviously, for the VA, you must have direct authorization, and we have to make sure who we're going through. So I want to make everyone aware. On a basic term, the West Coast will be TriWest. On the East Coast will be handled by Optum Health. You will have to enroll directly with Optum Health, but they're not very difficult. You can go right to their site. It's myoptumhealth.com and click on provider enrollment. There is no charge to do so. Also, one last note for today, just an update since we're talking about United Healthcare. This began September 1st, though in some states, I think it began a little earlier. And it's to remind you, all physical medicine codes, that means everything from a hot pack to an unlisted therapy, require what's called the always therapy modifier, which is GP, or it will be denied. So you want to think of if you're going to bill heat 97026, you're going to put a GP modifier on it as well. This modifier is required for all plans that affiliate with United Healthcare. So this would include Optum Health as well. So again, highlight physical medicine codes require a GP. Acupuncture does not, but physical medicine. If by chance it's a code that needs an additional modifier like a 59, you will need to have both modifiers, but the order of the modifiers does not matter. You may use 59 GP or GP 59. I do want to highlight, though, please make sure to include the GP or they will deny you. In fact, if you call them, because they will indicate on the denial you're missing a modifier, if you ask them what modifier was missing, they literally will not tell you. Now, this is Sam, and again, I definitely want you to always be on top. Our news section contains always information on what's changing. So if you go to our Facebook page or to Instagram, we put a news item there. Please go to our site, which is aacinfonetwork.com. Take a look there in the news section. We're always there to give you information. Look on the news section, but also just look on the highlights. We have upcoming programs to really help to make sure your practice is succeeding. We're your number one advocate. The American Acupuncture Council for Malpractice, Insurance, and Seminars wants to be sure you're doing well. I thank you for the time, and next week's host will be Lauren Brown. Until then, take care, everyone.